Welcome to the PT Marketing Power Hour, highlighting successful marketing strategies from North America's fastest growing clinics so you can learn from their wins and power your practice growth. We have another great episode today, so don't forget to hit subscribe on YouTube or wherever you get your podcasts. Now, here's your host, physical therapist, marketing expert, and CEO of Practice Promotions, Neil Trickett.
Hello, and welcome to the PT Marketing Power Hour, highlighting successful strategies from North America's fastest growing clinics so you can learn from their wins and power your practice growth. I'm your host, Neil Trickett. I'm CEO of Practice Promotions, and today's focus, we're going to talk about how to get the most results and revenue from your billing. And so we've got our expert here, Matt Slimming, with us. He's the CEO of PT Pilot Billing. He also is a physical therapist and owner of Star Physical Therapy, which has, I think, Matt, was it like 7 locations?
7, yep.
Yeah, and also a management group. So he does consulting and training for other clinics. So Matt is a wealth of knowledge here and one of the most nicest people that you ever meet on the planet. It's great to have you on with us today, Matt.
Well, thank you, Neil. Great seeing you again. Lovely talking with you. Appreciate you saying nice things about me that not everyone would agree with, including my wife, but it's nice that you said them.
Yeah, absolutely. So let's talk here about the industry, right? So a lot has happened over the industry in the last 10 years, 5 years, and especially the last 2 to 3 years here. And I think we can both agree that it's quite challenging in today's environment. But we do see practices thriving, and I know that you help a lot of clinics thrive in a challenging economy. So let's talk a little bit about that. So for you, Matt, in your opinion, what are some of the things that you've seen out there that are the biggest challenges that PT owners face today?
Yeah, great question, Neil. There's a lot of pain out there. There's a lot of suffering amongst PT owners, and it does vary a little bit by region. We do see some states suffering more than others, but it's a pretty universal thing that everyone's experiencing financial challenge. And the big factors, of course, are declining reimbursements. Medicare's big cut with PTA services was huge, and that was, of course, carried over by a lot of other payers, and then additional cuts this year. And they've just gotten to the point where they're really hammering the profit margins, and of course, you add to that the increase in expenses and payroll has really hurt a lot of owners. So, yeah, I think those are the two big factors. Pay rates have gone up, not just for PTs, although those have, because the student debt burden is pretty significant, but also for support staff has increased a lot. So, and more is required of those support staff at the front desk or whatever. Mm-hmm. So it's tough. I was at the APTA headquarters earlier this week for a biannual board meeting of the Impact magazine, and every owner's kind of feeling the same way, to the point that some are questioning, how they're going to make it work this year. But yeah, significant headwinds, as some would say.
Yeah, and there's it's about being even better in business today, right? And I would say, today, especially in this challenging environment, you got to be able to work smarter, or not necessarily harder, right? And really good business practices will prevail, right? And those clinic owners that train themselves and learn how to be better business people, how to manage finances, how to be very good in their operations, those are the ones that are going to be successful in today's environment. And there's tons of opportunity in our industry, right? Yeah. If we're looking in the right ways, if we're willing to think a little outside the box, and also be smart about how we're being business owners, working on our business, not in it.
Yeah. Yep. So true. I think there's plenty of opportunity. The outpatient PT industry is massive. There's a lot of revenue flowing into the outpatient PT industry, possibly more, than in previous years because of the increased access to PT. And, we're seeing some payers pushing patients to PT. I'm having, conversations with surgeons who are bemoaning the fact that, I've got to get my patient to physical therapists before I even do an MRI now. And so there are a lot of good things going on, that weren't happening 5 or 10 years ago. So lots of room for optimism for sure.
So for you, you own and operate a large multi-location clinic. What are some things that you've done to overcome these challenges in your practice?
Well, I think it was probably about 10 to 15 years ago that it became apparent to me that it's probably 15 years ago that it became apparent that you can't run a PT clinic anymore as a hobby or as a calling even, right? I mean, we're all called to it, but you've got to be more than just called. You've got to, as you mentioned, you've got to carry out the disciplines of business ownership, business management. So, we for a long time have been identifying the KPIs that we really measure, and we adhere to targets to optimize our profitability. And so really this year with the challenges, it really hasn't been as big a deal. We're recognizing that, yes, profit has diminished a little bit. We're taking some steps to address that too. But, I think the most important things that we focus on are the KPIs of timed units per visit, the visits per case, and the CPT mix ratios. We measure a lot of other things, but those are the key things that we measure. If we get those right, then we're doing pretty good. And now we're moving to saying, okay, well, it's not just measuring this for commercial insurers and for federal insurers. Now we're going to look at those flat rate insurers as well and be intelligent about how we're treating those patients, being aware that, hey, if you're not being paid for a full hour for an insurer, is it really intelligent or responsible to have the patient under the care of a PT for a full hour? So, making sure that we're just having to dig in with greater specificity based on payer group and payers as to what we measure and what's important to us. So those are three things, and I think measuring those KPIs and then determining, okay, which insurance companies do we really want to work with? And I think this is the year that a lot of PTs are going to say, hey, let's dump some payers. And that's great. That's going to have to happen. Yep. But I would just really caution PTs to think first, do I need to dump this payer, or could I adjust the way I'm treating a little bit? And maybe that would allow me to keep the payer. That's something to be considered, I think.
I think that's a great advice there. And I remember when I was in practice and running my practice, there was a time where I wasn't as good about understanding billing, right, and the processes, and it led to financial strain for sure. But that forced me to take a good hard look at our billing processes and systems and work hard to improve them. And it had a significant impact on the business. And it wasn't just necessarily the billing component, but everything on the front end of how the therapist understood how to bill, right? And when was the right time to bill? And like you said, in treating different kinds of insurances and the patients with those types of insurances. And I think for some of our audience out there, they do have patients with insurance that pay well, and they have patients with insurance that don't pay well, right? Mm-hmm. And so we're conditioned in a way to provide the best care that we can for everybody, regardless of payment, right? But in today's world, we have to be a little smarter. You get what you pay for, right? And how can we deliver good care, but we might need to adjust that time of care or whatever we're giving based off of the type of insurance. And one of the things that I always said was you have to really look at your worth. Mm-hmm. So what is the cost to you of running everything per visit? Have you done that? Have you looked at cost of your front desk, your rent, your operations, your therapist salaries, broken that down by the number of patient visits that you could see in your clinic, right? And what does that come out to per hour? Like, hopefully you know that number, what does it actually cost me to run per hour to deliver care? That helps you make better decisions about what the level of revenue I need to generate from that particular patient visit. And is that insurance company going to be that? And we might need to have a conversation with that insurance company that they're not meeting that need. And we might be better off not taking that particular insurance. That's something in it too, right? Or we might need to adjust the way that our therapists bill for things, right?
Yeah, I think it's essential that we're good stewards of our businesses, and that will mean having difficult conversations with payers. And ultimately, I think for the free market to do its thing, we need to have some payers lose some providers and insert in areas and realize that they need to adjust their payment rates. I think that we have been a bit slow as an industry to take that step.
Yeah.
And it doesn't help anyone. I think if the more responsible we all are, and not just be looking for full schedules in which we're losing money, but be looking for every visit being a profitable visit, then we'll all be better off with insurers saying, oh gosh, in this region, I can't get enough PTs to handle all our subscribers. And they're going to, that would be terrible for an insurance company. They'd lose their subscribers, of course.
Yeah.
And so
We've seen that.
Change.
I'm sure you've seen that. I know I saw that when I was working in South Florida, that there were big groups of physicians that got together and said, we're not going to take any less than this. And so when that insurer was going to lose most of that type of, say, orthopedic provider within a certain couple of counties, they can't have that, right? They have to come to the negotiating table. And like you said, we've kind of been slow in our industry to come together at locality levels and say, you know what, we're not, we as a group, we need to be able to have this kind of compensation from that plan. So there are opportunities.
I think it's not easy to do that, right? I think in fact you have to be joined in some formal manner to be able to make those decisions. So yeah, it's tough for one PT down the street from the other to get together and have those conversations. I don't think they're allowed to. but if we negotiate as a group, if we create an informal group together, or rather a formal group, then maybe it's possible. But yes, got to keep pushing.
So you've worked with a lot of different clinics and on best practices and also on billing. So what are some of the ways that you've helped PTs increase their practices profitability?
Well, it's one of the benefits, of course, of having our clinics for 20 years and still managing them is that when these changes occur, and whether it's remote therapeutic monitoring becoming an opportunity, or MIPS, all these recent payment declines, we're able to work out what is best practices, swiftly in our own clinics, and then share that with our clients. So that's a big thing. Later last year, we shared about, okay, these are the options with remote therapeutic monitoring. It's, if you're this size, it's probably worth doing. If you're this size, do it like this. If you're this size, do it like this. So that's the first thing, I think, is that as we're in the industry that just changes all the time. And so our ability to, as a billing company, guide them in how they perhaps should be dealing with these changes is huge. Who has time, right? I feel for these PT owners that have one or two clinics, they don't have time to do 40 hours of analysis on their insurance payers to work out the best way to change treatment protocols or whatever it might be. So, I feel that's our role. But I think the biggest opportunity when we bring a client on to do their billing and revenue cycle management, after a month or two, we have a good hard look at their data. And from that data, we're able to say, okay, this is how many time units you're billing per visit for commercial, for federal, for flat fee. This is how many visits you get per case on average, and we know what the ideal numbers should be. And so we take that information, we share that with the owner, and then we say, look, this is a tough conversation that you may have. Okay, hey guys, you're billing 2 time units too few per visit for this group of payers. That then becomes my role. I love those conversations, so I will meet with the PTs through Zoom, and we'll have those discussions, and I'll share why, hey, this is why we need to hit this number, this is how to do it, And so it doesn't happen quickly. A lot of PTs have been used to billing a certain way. They generally want to underbill, which, by the way, is perhaps as unethical as overbilling, because you end up you're providing the patient some financial incentive if they have a co-insurance to attend physical therapy. So that's not a good idea. So you don't want to underbill, you don't want to overbill, but PTs have been used to underbilling and maybe letting patients leave the clinic, before the right number of visits. They've been just letting them self-discharge too early. So there's a whole process that we coach the PTs in how to address, all of these items to get their KPIs in line. And for most clinics that we bring on, the things that we identify, it amounts to about a 40% increase in
Wow.
gross revenue if they did all these things correctly.
Yeah.
And it varies with region. There are some regions that the payers just aren't going to allow X number of visits. If their payer mix is not diversified, if it's a little bit lean in payment, that can reduce the increase they can get. But that's about the average that we see. And it's when you compound all these little things. So you're compounding maybe your fee schedule by your units per visit, by your visits per case. That really multiplies the gross change that you can have over the course of a month.
Wow, yeah, that's tremendous, 40% too. I had a good friend of mine, Sean Kirk. He said that the most money you will ever lose is the money you never made. And
Wow, that's great.
so if your therapists don't have a full schedule, if they have holes in their schedule, and
Yeah.
if they should be billing certain codes at certain times for the things they did, but they were used to billing it a certain other way, and that's not as, uh, not as high of a dollar amount per code, that's all money left on the table, right?
Right.
That you should be paid for, because those services were provided. And it comes back to training and education of our team, knowing of when to bill at the right time and what to bill, right? That's
Yep.
also going to give the best care possible, but be done in a way too that helps be the most profitable also, right? And so that's needed more today than ever, right?
Yeah, and it's not coincidental that Medicare sets their payment rates where they reward the types of treatment that they feel is most beneficial, which is
Mhm.
functional related type training and the more involved physical therapy. So it goes along with giving great care. If you give great care where you're really involved, you're doing high level therapy, you should be billing those codes that happen to pay more. So it all goes hand in hand.
Yeah.
You do a better job with the patients, you end up billing more, you end up seeing them for more visits, and the payers pay you more. So it does all work. There are systems out there that support that kind of behavior. So
Yeah.
we just help out and help the PTs to become aware of that.
So, man, your experience in working with different clinics there, what is the biggest mistake that you see happening in insurance and billing?
Well, we see a lot of new clients that come to us. Their old accounts receivable hasn't been worked aggressively, and insurance companies, they play games, borderline illegal,
Yeah.
certainly unethical, where they will not pay something, a line item, for example, for no good reason. They're just going to, nope, not paying that. Just going to forget
Mhm.
about paying that. And you've got to call on it. If it's not paid, you've got to call on it. And you've got to call on all of these every single month. You can't just hit them once and then hopefully they'll pay. No, you got to go back again and again. And we've had insurance companies say, "Oh, sorry, that was an omission." Just um, so it's mind numbing that this can happen, right?
Yeah.
At these companies that have just enormous resources, tremendous profits, amazing software systems that they can employ. They can just apparently miss paying on a line item. But if we don't do that, if we don't hit every unpaid line item over 30 days every month, that's your profit margin.
Yeah.
That's the stuff that, like you said, that's the most money you've lost. It's money you've not
And
earned.
you worked for it, right? It's not that you didn't do your you did your service, you
Yeah,
should be paid for it. But I think it's important for people to realize that it's the game, right? It's the insurance company. They play games. I remember we took United Healthcare to the State Commission of Florida twice.
cool,
um,
fantastic.
yeah, and because it was something silly that was on their end, right? That they were responsible for. But I can tell you one thing: we ended up hiring a person that we look for. If you have a billing and collection person, they got to be a bulldog, right?
Yeah.
You got to have someone that
Oh,
has no problem getting money, right?
that's right.
That's your key person right there. So if you have that kind of person in your billing team, you're going to get that AR collected, and like you said, that's money that you should have in your pocket, right? And if it's not, then it's just lingering out there in the insurance company's pocket.
That's right. Yeah, it's not how it should be, but
Yeah.
yes, as you say, that's just how it is. And yeah, I mean, recently, Blue Cross up in Michigan and probably other places too, just decided because of some incorrect perception of something that Medicare once said a few years ago, they're not going to pay this code when it's billed with another code. It's not based in truth. They just decide, oh, and they quoted Medicare. And so we have to go back and appeal every one of these line items per claim. And what do you know? They're like, oh, yeah, you're right. Hey, we should pay. But if you don't, and I guarantee you there are clinics in that region that are not fighting that, they
Mhm.
lose out on all those line items. And it adds
Yeah,
up a lot.
it sure does. And so, what happens to a practice when it doesn't earn the revenue it should?
Well, that's when things get scary, right? The first, and it's, you know, I empathize greatly with these owners. They'll often come to us because they're hurting and they realize, oh, it's my billing company or my in-house billing person. Just it's getting beyond that person. It's more than they can do, and they're struggling and it's tough. They're stressed, but I think what classically happens is they're not really aware of it initially. They just put it down to, okay, we've had just a couple more months this year where I couldn't take a draw, you know, and
Hmm.
then it gets where, oh gosh, I haven't taken a draw in 3 or 4 months, and then it becomes, I can't pay myself payroll, and then they'll catch up again, and then they get struggles with other staff payroll, and then they don't invest. They start to drop out expenses like marketing expenses, which are crucial. It's like a knee-jerk reaction. Oh, where can I cut? Oh, marketing. You know, I can not pay that this month. It'll be okay. But then you leads to horrible consequences. Of a less full schedule, which just compounds the problem. So it's tough, Neil, when these practice owners come to us and they've been going through this for 6 months or so, and they're very stressed.
Yeah.
They're not always paying all their mortgage notes, things like that. It's tough. It's a tough place to be. So, even I would just reach out to every PT owner now. You're definitely experiencing, if you're in the insurance game, lower payments. Don't Even if you're doing everything correctly, you're experiencing lower payments than you were, a year or two ago. I would say just don't wait to analyze your data, to dig in and to see what's really going on and to make some tweaks to hopefully improve things, because
Hmm.
inevitably it will get a bit tougher. So just don't wait, because then you don't want to be in that situation where you're having to cut expenses.
Yeah. And I think for some people, like, I've been there too, like you can feel out of control,
Yeah.
right? There's so many things hitting you from different sides, right? Whether it's staffing, whether it's revenue, new patients, costs going up for rent, like all kinds of stuff that can be hitting you from different angles. I think the one thing to understand is that you can be in control.
Yeah.
So if you have to have the time to work on your business. So if all you do all day is treat patients, you can't manage your business that way. You can treat patients, but you can't be treating them full time and run your business at the same time. Sometimes we gotta make it happen. I understand that, right? Sometimes you gotta like dig in someone, left temporarily, and while you're kind of organizing yourself, you got to cope with what you got, right? That happens, right? You got to put some extra hours in, but
Mhm.
you can't live like that, right? And so you got to set, as a business owner, you have to set time aside where you can be looking. I'm looking at my metrics. I'm looking at my billing. I'm working with my billing company. Like that there's has to be time there to do that, um, because if you don't, what you just said is what the outcome is going to be, right? You're more out of control.
That's so true. Yep.
Yeah.
Yep.
And
And it's
so
not easy for the new guy, the new PT clinic owner who's just starting out. Of course, he's probably working 60 hours a week trying to see patients and do those other things that we've discussed. And there
yeah.
there probably is a year or two for most owners where they have to kind of endure a bit of that as they're growing
Yep.
their business. But yes,
Yeah.
I totally agree. Get out of that situation as soon as you can,
Right.
and open some time for you to manage, yes, manage your business. And also, it's kind of it's a fairly new concept, probably relative to you and I, Neil, but self-care. It's the burnout is real,
Mhm.
and probably many years where you and I just pushed through, and left some things with not enough time for them, like kids or something like that. And you know, it's important to carve out time for self-care to stay healthy mentally and physically.
Yeah, absolutely. And so for you, as you're working with different clients, like what are the key areas that you tell practice owners to focus on when it comes to billing? Right?
I think if we are not doing their eligibility verification and authorization, because some we do that for some clients, but not for all. If we're not doing that, then that's the first thing. They've got to really make sure that they're doing that well. Otherwise, they're going to have visits that won't be paid on. So that's big. The KPIs, certainly, measuring those things that we've discussed already are very important. But we measure that for our clients, so they just get to sort of see the data. But if you're doing that yourself, you're billing yourself, you want to measure those KPIs. You want to really, if you're doing your own billing, you want to look at two numbers: your ARC ratio, which is really your gross AR, not including auto and attorney, divided by the average of the last 3 months' charges, not including auto and attorney. So it's basically your AR divided by your average charges, and that gives you a number of how long it takes you to collect. We don't include auto and attorney because, of course, there's no telling sometimes how long that will take. But if you measure that, it's a really good indicator of where your billing cycle is at. And anything below 1.0 is okay, fair. Anything below zero point 0.8 is good. That's kind of the standard that we go by. We want to get all of our clients to below zero point 0.8. Sometimes there are software issues that make it difficult for some clients, payer issues, but those are the key things to watch. If your ARC ratio is below zero point 0.8, as long as no one's writing stuff off that they shouldn't be, then you're probably in a very healthy place.
I gotcha. And so would that also, or would this be a different metric in terms of your percentage of AR that's over 30 days? Like, is that in that same realm, or is that a different metric that you want to be
Yeah,
measuring?
well, it's in that realm. We don't measure that. We look at AR over 120. So it's not it's easy for claims to go beyond 30. But by 120 everything should be pretty well down. So we
Mhm.
say maximum of 10% in 120 plus. And that way you're still going to have some. There's invariably there are insurance companies that just play those games and they don't respond quickly, and you've got to keep on finding them. They can take a few months to get all those amounts paid. And then there's patient responsibility as well,
Mhm.
which can drag out, particularly if you offer payment plans for patients. So depending on your policy of having to collect upfront or being able to bill patients over time, that can add to that as well.
Gotcha. And so when you've worked with different clients, and maybe they've come from a different billing company or trying doing it themselves, do you see that that sometimes like write-offs are encouraged, and you have to kind of say no, that's not that good of a thing to do?
By the billing company or
Yeah,
or the billing
I'm just
person in
curious.
clinic?
Yeah, is
Yeah,
that something that you see happen or not really?
yeah, oh yeah, certainly. We see not so much. I wouldn't say that billing. I can't imagine that billing companies are encouraging write-offs that wouldn't be valid. It may happen. I've not seen that. I think in-house billing staff probably, when they've got a really busy owner who's not paying attention and doesn't have the time, I think those teams, it's probably done where they will say, "Oh, this isn't collectible. We're going to write it off." But every potential write-off should certainly pass by the owner's desk for their
Mhm.
signature.
Well, that's
before
a
it's
good
written off,
policy. Yeah, that's a good
because
policy.
there's
It
a lot
creates
that
some
can be done.
accountability, right?
Yeah, there's a
Yeah.
lot. I mean, there are a lot of things that can be done to get paid. Now, if you don't have authorization and the insurance company has said, look, we're not paying, there was no, the provider wasn't credentialed, or and we're not going to allow a different provider to sign off, or the authorization just wasn't there. Yes, eventually you have to submit those to the owner
Mhm.
for write-offs.
Where do you see most billing mistakes happen? Is it on not setting things up correctly at the beginning? Like, say, do we get the right authorization, or the right information from in the intake? Like, is that where errors typically happen?
Yeah, I think that is, for the clients that we work with. Yes, that's where the errors happen. Is it's the eligibility. Maybe it's the wrong subscriber ID, or maybe they've used the wrong insurance, and so you've been billing the incorrect insurance, who has different rules from the correct insurance, and then you can't end up getting paid by the correct insurance because you need authorization, or there's a timely filing issue perhaps, or yes, commonly the authorization isn't done, or re-upped in time.
Okay.
Um, but when we, as I said, when we inherit, when we bring in a client new, I think the biggest errors we see are just claims just sitting out there, not being worked. And unfortunately, the easy thing is just to resubmit a claim. And we see a lot of that. We just brought on some clients actually in South Florida, but their prior billing company at the end of their tenure just resubmitted everything, resubmit, which doesn't really do the job. Sometimes, occasionally, if an insurance company says, "Yeah, we never received the claim," that can work. But usually, the insurance company is looking for something else, and so you have to go back to the notes and
Hmm.
create an attachment or something to get paid. So it's not intelligently and correctly working outstanding line items.
Yeah. It it's such a wacky system when you think about it. Like,
It is.
the amount of time and effort to get paid, right? And it's because we work with a lot of Canadian clients too, so
Yeah,
it's very different in Canada, right? In terms of like how
yeah,
they get paid. Usually get paid, within a short time,
right.
for what they bill. So it's a very interesting system. I remember one time I had a patient who was a hospital administrator, and we were chatting about billing and administration and all those kind of things, right, that go along with getting paid for the services. And he said that for that hospital system, 15% of what they spent was just on getting paid, right, with billing.
Wow,
Crazy,
wow.
right? So
That
15
is
cents on every dollar went towards just the system
the
of getting
process of
paid,
getting
right?
paid.
Yeah.
Golly,
Yeah. And so for
a high
you,
rate.
as you work with different clients, like how much dollars do you think the average PT really leaves on the table because they just aren't billing the way that they should be?
Well, yeah, I guess there's quite a broad bell curve here, right?
Mm-hmm.
There are some PTs who are killing it, and they're billing just right, and they're doing everything correctly. Visits per case is great and everything. And then there are clinics on the other end of the bell curve that are you're surprised that they've been in business. But I think the average is probably about $8,000 a month. If
Wow.
they're yeah, if they're the average PT, the way they're billing, because they've been, I think over the years it's been drummed into their head: compliance, compliance, don't overbill, don't overbill, and they will do anything to avoid even the appearance of overbilling. So they just end up really erring on the downside. And if you're not really working hard at engaging your patients to really optimize, to achieve optimal health for your patient, and therefore see them for enough visits to get them healthy, really easy to not get the correct number of visits
Yeah.
in the clinic. And that's a huge factor in that $8,000.
Yeah. I just had a thought when you were talking about that, and that is, you know, we hire therapists, right? People are trying to get therapists to come on. So whether it's a new grad or even a seasoned, therapist that comes on board with you, they're bringing their way of billing with them, which may
Right.
not be in alignment with how you do things in your clinic. So I I think this might happen that clinic owners don't think about that, and they just assume, especially if it's a seasoned PT, right? They might just assume that they bill the way that they should be, but that person may have been taught or figured things out in a totally different way that we're underbilling, right?
Yeah.
Um, and so I think part of any onboarding, and hopefully this is done. So part of any onboarding that is done with a new therapist in your clinic, how you bill and why, and the billing process should definitely be part of that onboarding process.
Without a doubt, that's essential. And then every month we recommend reviewing how they're doing on those metrics,
That's
because
great.
I mean, it's, if it's new for someone, it's not going to change with one discussion. It
Right.
could take 6 months of coaching, training, and after 2 or 3 months, they can have questions. Now, can I really do this if I do that? And it requires some back and forth. The clinician has to gain the trust, that this is the correct way to do things, and it just takes time. So it's monthly, measuring those KPIs, reviewing them, helping the PTs understand it.
Yeah, gosh, that's such a great point. Yeah, because I think that's such an area that's probably overlooked by many practice owners because they're busy and they probably just don't even think about it. But the time that it takes to train, therapists on how to bill correctly, because
Yes.
it's a complicated system, and it's an important part of how you do get reimbursed properly. So,
It's
um,
probably about an hour a month, an hour a month
okay,
per,
yeah.
per PT or 2 or 3 PTs
Mhm.
together. Yeah.
Wow, fascinating. So yeah, so for audience out there, make sure that you're allocating that time, um, educating yourself, right? And then allocating that time in the month to make sure that you are going over those metrics with your team, and that there's training that's being done around billing, and that would make a big difference in your bottom line, right? So what are some of your tips then for PT owners, who want to get paid more by insurance?
Well, I think it's a difficult thing to do, but it's worth it doing one time. Is just reviewing how these payers are paying you, and just create a little bit of a spreadsheet by payer, and just some things that you notice about their behavior, about perhaps what their maximum payment is, and what achieves that maximum payment, what groups of codes bring that maximum payment. Do you get maximum payment with just 2 codes? For some insurances, yeah, if you build 2 codes, that's the most you're going to get. If you build 4 codes, you're not going to get any more. So looking at all these things will allow you to sort of just create some, not rules, but suggestions for your team. And I think if you share with your clinicians, hey, this is how this insurance pays us, this is how this, and you make a little spreadsheet, these are the units that get reimbursed the best. It's worth them. We're not saying that you need to treat every visit to optimize your revenue, but if you at least know that, it allows you to make good decisions. And
Mhm.
and so I think, and then sharing that information with your PTs, I think that and your KPIs are the two things that need to happen to optimize how much you're getting paid by insurance,
Yeah.
and making sure you're going after all the unpaid AR, as we've said. Yeah.
Yeah, absolutely. Right. And so, I'm sure you get this question too, but if I was a practice owner, like if I've done some internal billing, like or maybe I've used another billing agency before, but like why would I use an outside billing agency?
Well, I think I would say, just transparently, if you're doing it in house and you've got someone that's super reliable, doing great, if you measure their arc ratio and that's in line, and they're not writing anything off, then I would say you don't need an outside billing agency yet. You know, the problem with that, though, even in that situation, is you're so dependent on that billing manager, that billing person, and what happens if they go out sick? What happens if they leave?
Mhm.
We know it is very, very difficult to keep and hire and pay those people enough in the clinic to do that. But if you're in that role, if you're in that realm where your arc's in line and everything's good, then I would stay the course. But
Mhm.
if you're finding yourself that the income is starting to drop, you've noticed some challenges to your bottom line. Um, I think the first step is to have someone do an analysis of of how your AR is sitting, and of course we do that for clients. I think other billing companies do, so that if you wanted to say, "Hey, how are we doing?" you can get a really clear answer that, okay, it's good or it's bad. The other thing I would say is that if you're spending time every month with your billing department, and you're trying to understand that information and you're managing that, it's probably not the best use of your time as a PT owner,
Mhm.
because we feel like, yes, you probably need to be treating patients to some degree, but you should be really involved in your marketing program, your external local marketing program, and you really should be involved in managing your team, your PT, your clinical team, and really working on culture every day. Peter Drucker's quote of culture eats strategy for breakfast is one of my favorites. And that's made a huge difference to how I run our business. And that is really working every day intentionally to reinforce the culture that you want to see in your organization. Because if your team is engaged and happy and seeing, good compensation, they are going to take care of your patients. And that word of mouth is going to be huge for you guys. And all your KPIs will actually improve as well.
Nice.
So those are the things. And I think if you're spending time on those things, there probably isn't a lot of time left over to really deep dive manage billing like it needs to be managed. So
Yeah.
I think for most people, it's probably a no-brainer. Also, when you deal with a billing company that can then guide you to, hey, tweak this, and this to increase your revenue, your net increase is normally far greater than any cost of billing would
Right.
be.
Yeah, good points there. Yeah, and it's about the process, right? You learn new processes or things that you just didn't know about before that the billing companies had best practices on uh, with that. So for you in dealing with different clinics and if you have a clinic that's say one or two therapists and they need to ready for that next hire, that third or even fourth therapist, like we do know that hiring is an issue today, but with your obviously you got the billing side, you've done management for consulting for different companies too. What are some of the things that you're seeing that can help with hiring for therapists?
Yeah, I think I think first of all, I would just say, hey, make sure that you need this person. And so in this current environment, you want to do your analysis of your insurance companies. If there's an insurance company paying you less than your cost per visit or per hour, and you can't make that up in volume, then if you don't need that insurance company and you drop them, that would decrease your volume, but if it would actually increase your profit versus keeping that insurance and hiring the new PT. So I think that's the first thing, is make sure you need that PT. Second thing is I would make sure, for a lot, compensation is the challenge, right? It's hard to pay what they're asking. We find if you really hit your KPIs, your profit should be such that you can afford to pay PTs better than most of your competitors. And the third thing I would say is that what really helps is being a site where you can be the clinical instructor for placements for universities. So hopefully there are some universities in your neck of the woods, in your general area, or that pull from your area for students.
Mhm.
Reach out to them, be a resource for them, place students. It's fun. Most PTs actually enjoy the education mentoring process. Helps you stay on top of your game, but it also then it's important to stay connected with these PTs over time, especially the ones that you liked, that you got along with well. I think if you do that and you host a few PTs every year, you probably won't have trouble hiring when you need
Mhm.
to. But you got to that's sort of something you've got to do early in the game. If you're
Right, it's long
suddenly
term.
now, yeah,
Yeah,
it's long term. But I
yeah.
think I think your best bet now is get your KPIs right, get that revenue up, get your income up, and then you'll say, oh gosh, I can offer this incentive. And I would really caution against increasing salaries dramatically, but you can it will afford you to pay bonuses
Mhm.
based on them hitting these KPIs. And
Yeah,
if your new PTs are hitting their units per visit, their visits per case, all these different things, you can probably afford to pay them a bit of a bonus.
yeah, yeah. That's a great idea because I think naturally the best clinicians out there, right, that are obviously very good at what they do at helping people, but also are good team players. They gravitate towards the businesses that are doing things right,
Yeah.
right, that know how to run the business well. Obviously, they're going to get compensated, fairly for that, and they like being in that culture, right? They like being in that environment. So, that's why, again, like, it just behooves you to spend time on your business, to get your KPIs right, to really be having the whole team look at that with you. You've got your billing processes in, right? You're getting good collections. You can afford those, performance bonuses and things like that. That's what retains people, right? And it also attracts people to you too. So.
Yeah, as I'm sitting here, I'm thinking we're talking a lot about KPIs. There are probably some PTs out there who are maybe hearing KPI for the first time, or it's like, what KPIs?
Mm.
So, if someone wants to reach out to ask deeper questions about KPIs, I'm happy to throw back an email to explain some things.
Sure. Yeah. It's key performance indicators, right? So,
Yeah.
yeah. And so, there's to me, there's three things that we need to focus on in business, right? One is getting new business in the door, right? That comes down to your marketing, how you're getting new patients, and then the operations, right? So how are you actually delivering that care and making sure that all happens as it should be, right? And getting the best possible results for patients. And then third is anything to do with finance, and that comes down to your insurances, your billing processes, how you're managing your money, right? Taxes, all those kind of things fall on that category. So, like, as owners, we like to gravitate towards, hey, how's the money coming in, and then how are we doing with our operations? But a lot of times we kind of fall a little short in terms of our marketing and new businesses. But Matt, you've done exceptionally well with Star Physical Therapy clinics in Louisiana there. And so, we've had the fortune of working with you for quite a few years now. And so for you, like, what marketing systems and strategies have really helped Star Physical Therapy over these years?
It's a great question because probably about 15 years ago, we had to have a hard look and say, okay, business just doesn't hops at that time. Hops and pops were kicking butt, right? And I guess that lasted beyond 15 years ago, but that's when it started, and we felt that, and we realized, oh, it's not just I can't just be a nice guy locally, and go out and see some docs occasionally. We had to put some systems in place, and it's you've got to invest the time and money in having good systems and good things going on consistently every single month. And so I think there are a few things that have really been crucial for us. Um, Neil, everyone knows if you're in a town, if you're looking for something that you're not familiar with in a town, the first place you're going to go is Google, right? You're gonna look there, and you're going to see what website pops up, or what has the best Google reviews, or what Google ads pop up. So for us, it's been SEO and website development. You've got to have a great looking website, and you've got to show up in those first five if you can. Not always easy in every market, but you guys have helped tremendously with that. I would say, even to the point, we get the reports every month of how our SEO is doing, and I'll meet with your team and we'll say, hey, this clinic, we've had a little bit of struggle with this clinic for a couple of months, some PT issues or something. We really need to fire that up a little bit and see if we can show up a little bit higher. There's more competition in that area. We need to show up a little bit higher in the ranking, and your team will work with us on that, and make a change, tweak the needle. And I know just enough about SEO to know that it's a lot, and more than I can easily do. So yeah, having you guys help with the SEO, making the website look fantastic, has been huge. We added Google reviews, Google ads. That's, boy, let me tell you, I was trying Google ads, Neil, by myself for about a year before I came to you guys and said, hey, would you mind doing this for us too? And I was spending so many hours on that. And this was, gosh, I don't know, 4 or 5 years ago maybe, and I was not succeeding. And your team have the magic science down somehow. You've got the secret sauce, because that has made a big difference. And newsletters have been really helpful. The reactivation of patients is so important. Newsletters, both in print and by email, are huge. And we do some Facebook funnels as well, which are really nice, which add to that. But yeah, certainly we have our feet on the ground, hitting the physicians' offices, but more and more and more, we know that patients go online,
Mhm.
and physicians go online.
Yeah.
In big cities, you can't have a relationship with every physician in town. Certainly not their front desk, and the front desk is sometimes the one who are telling where to go to PT. They're often Googling, just like the patients would. So yeah, that great online presence is huge.
Absolutely. Yeah. Maximizing that online presence. It's where you got to do it today.
Yeah,
Yeah, that's a great point. Cause I mean, uh, you know, you're an expert in your field. You're expert in billing and very successful business owner and things like that. And I think what I've learned too in business over years is that you can't be an expert at everything,
no,
right? And that's good business owners rely on consultants and billing companies and things that can help them because they have the expertise, the knowledge of that specific area, right? That can bring a lot more to your bottom line.
absolutely.
And so sometimes we kind of think like, and this is where I think some practice owners get into troubles. They try to hold everything that on their own,
Yes,
right? And they try to be the expert in everything, and it's very impossible. It's kind of impossible to do, right? So, the the good successful clinics are the ones that start to leverage outside help. Right? They
yes,
do they leverage practice promotions, marketing company. They use PT pilot billing company for their billing, right? They have a business coach or marketing consultant, right, that kind of helps them through things. So it's being able to think a little bit bigger, right, and use expertise in different areas to accomplish the goal at the end of the day.
yeah,
Excellent, great.
yeah.
And
I was
so for
chatting
you,
with an
man, I'm
owner.
just interested to hear too, like working with practice promotions all this time. Like, do you have any patient wins to share?
Oh my goodness, yeah. Um, Something that I shared, that there was one clinic that we said, okay, guys, we're gonna turn the dial up on this clinic, and that has been really cool. So there's one clinic that we was, I wouldn't say struggling, but certainly underperforming. The challenge, we actually had a series of PTs go through this clinic, and for whatever reason, having babies, leaving the workforce, not a good hire. That happened once. There was some turnover, and that had an effect on the clinic volume, new patients, and so we actually reached out and said, okay, we got a great new PT in place. They're solid. Everything's working great. Been with us for 3 months. How do we, let's increase the volume there, and we did. It took, like, I don't know, maybe 2 to maybe 3 months, and we had a 32% increase
Wow,
in new patients in January over last January. Referrals. So this isn't just a challenge with us converting. This is actually referrals, and then a 48% increase in February over last February in this clinic.
amazing.
And it's, we're not doing much different. It's yes, we have a good PT there now, but that's dramatic improvement from tweaking marketing, from you know, im, improving SEO in one area. So that was huge. And another one we've had, we have that's a slightly newer clinic for us, right? That's been
Mhm.
around not too long. Our oldest clinic has been in business for 20 years, and we've also noticed dramatic changes there. Just with, I think Google Ads may have been the big factor that we added there with you guys. We had let's see, we normally have, like, we will rarely get above 100 referrals in this main clinic. It's probably, once or twice a year we'll get over 100 referrals. Well, in January we had 174. That's 50% more than we've ever had. And I think that's, partly maybe increased availability or access to care, but certainly just consistent effort at SEO, website development, all the things that you guys do. The newsletters have just really bumped things up in the new year, which is nice, because January is always that month, right? We're like, okay, let's see how January goes. Are we going to be busy? You kind of feel that may set the tenor for the year. So when we had 174 referrals in January, we thought this is going to be a good year, and it has remained. So yeah,
Fantastic.
lots of wins, lots of wins.
Awesome. Fantastic to hear. Well, Matt, thank you so much for being on the call today, downloading your expertise on billing here and what clinics can be doing to improve their revenue. What is the best way for people to find out more about what you do?
Probably email me would be the easiest. It's Matt at ptpilotbilling.com, ptpilotbilling.com, and it's Matt with two T's.
Great,
And yeah, I'll get back to them quick.
Yeah, so shoot Matt an email there. Don't forget also to check out ptpilotbilling.com. That's Matt's billing company there. They do a fantastic job helping clinics improve their revenue cycle. So definitely check that out and see if that could be a good fit for you. Again, thanks, Matt, for being on the call today and sharing all your knowledge and expertise there. It's been a pleasure, and we look forward to having you on here again.
Thank you, Neil. Thanks for everything you guys do. Your company is just a treat to work with. All the team that we work with there are just great people. So really enjoy our relationship. Thanks for your time.
Thanks, Matt. Appreciate it.
Thanks again for joining us today. Be sure to check out practicepromotions.net/power. There, listeners can download over 9 checklists and free resources made to coach you through simple, proven marketing actions to increase new patients. So check it out today. That's practicepromotions.net/power, and I'll see you next time.